Good afternoon to you all. I'm Toni Horrell, and today I'm talking to you about making sense of trauma and how you make meaning out of trauma. Most people experience at least one traumatic event at some stage of our lives. None of us are immune from the possibility of experiencing a traumatic event or escaping the pain of human experience. Defence Force personnel, as I'm sure you know, are much more likely to experience multiple traumatic events, and some recent University of Otago research has found that 1 in 3 military personnel have symptoms of post-traumatic stress and 1 in 10 PTSD. There are many studies on post-traumatic stress and PTSD with associated recommendations on how to deal with it. However, there's general lack of awareness and understanding about trauma and trauma responses, and this can leave people who experience it feeling powerless and stigmatized. New Zealand culture isn't known for expressing emotions, particularly when they're considered weak, and this is all the more prevalent in military culture. One of the most important aspects of reducing trauma symptoms and preventing or treating PTSD is social support. Positive social interactions reduce the severity of PTSD, and highly perceived emotional support leads to better response to treatment. Conversely, limited social support is associated with severity of symptoms and possible suicidal ideation. Generally, it's expected that family, close friends, or therapists will support or treat a person who's experienced trauma. However, the importance of the daily environment and response of colleagues and acquaintances isn't given enough importance in relation to reducing trauma symptoms and helping that person make a meaning of their experience. This is all the more important in an environment where trauma-inducing experiences are more likely. In 1994, Stephen Porges introduced the polyvagal theory. This theory focuses on the vagus nerve, which connects our brain and all the major organs of our body, including the heart, the lungs, and the stomach, through various branches. This nerve also controls all the nerves that connect to the striated muscles of our face, as well as the muscles that control the intonation of our voice. By looking at another person's face and hearing the intonation of their voices, we read their response to us, and we can gauge whether that person is safe or whether they're dangerous. Humans are social animals, and as such, we're primed to detect social cues when we're with others. Kind voices are calming, anxious or angry voices tell us to be on alert. When experiencing the effects of trauma, a safe environment helps us to calm down, it helps us to heal, and it helps us to grow. In an environment where it's expected that individuals will rely solely on family and professionals for healing from trauma, the culture of the environment can continue to traumatize. A culture that emphasizes strength, courage, and perseverance may discourage shows of emotional weakness, and this will be reflected in how leaders and how colleagues respond to each other. So, to illustrate the points that I'm about to make, I want to describe a trauma incident and how I imagine it could have affected those involved in the rescue. This incident is the Whakaari White Island eruption last year. We've all heard of the courageous actions of the helicopter crews who landed on the island and were able to load most or many of the victims onto the helicopters. The injuries of the people were horrific, with one of the pilots, who was a former soldier, describing how shaken he was by the wounds. However, they couldn't fit all the victims onto the helicopters, and so they planned to return to collect those left behind. One of those involved in the rescue, Tom Story, commented on how he recognized one of the victims, and although he knew he was beyond help, he still just pulled him out from where he was and made him as comfortable as he could, so that he was there when they went back to get him. However, the crews weren't granted clearance to return then or in the next few days. Story commented, "It was pretty hard to take." I want us to look at the likely physiological responses of these helicopter rescuers to this experience. I want us to think about imagine how as they approached the island, they would have seen steam pouring from it. and as they hovered above, they saw bodies. Their sympathetic nervous systems would have begun to be activated. This is the system that primes us to get ready for action, to fight or to escape in situations of threat. The limbic system of these men would have been sending messages to their bodies to respond. Cortisol and adrenaline would have been released, which would have increased their heart rates, their blood pressure, and their breathing. Immediately on landing, they would have been ready to take action. Whilst they were on the island, helping to load survivors into the helicopters, they were also aware that there could be other eruptions at any time. They would have remained in this heightened state the whole time on the island, on the journey to the mainland, and once there, waiting for clearance to return to collect other victims. As we know, they didn't get the clearance then or in the next few days. I imagine it would have been really difficult for their sympathetic nervous systems to deactivate and for the parasympathetic system to return their body to its normal state. The parasympathetic nervous system is a system that tells our bodies that it doesn't need to be on alert anymore. Without this command to return to normal, the body would have continued to be flooded by chemicals, and this would have had an effect on the hippocampus in the brain, which has a role of storing and retrieving memories. These men would have been dealing emotionally also with the knowledge that they hadn't been able to return to collect survivors, perhaps even harder for Story, who'd recognized one of them. Story's comment that it was pretty hard to take really underestimates and understates what he emotionally probably felt. Undoubtedly, all these men would have experienced some form of post-traumatic stress. For those who've experienced trauma, dealing with these symptoms is made harder because there's an interference between the limbic system in our brains and the frontal cortex, which is our fighting system. This makes it more difficult to process what's happened, to read the situation, and to control our emotions. Again, the role of other people and their responses is of particular importance, as support and connection can help to ameliorate recovery. Social support is the most powerful protection against becoming overwhelmed by stress and trauma. Another aspect of trauma is the personal meaning we make from what happened. As I mentioned, the frontal cortex of our brains tries to place the situation within some kind of context and some kind of filing system. But cultural norms and personal belief systems influence the filing system and how we make meaning out of what's happened. For example, a culture that puts the blame on victims of rape because of the way they dress will influence how the victim perceives their actions. The belief that you were in any way at fault because of something you did or didn't do in a traumatic situation, especially situations where people were harmed, will affect how you make sense of what's happened. Can you imagine the difficulty these helicopter crew may have had trying to make meaning out of not being able to return to the island as they planned to? Or these men's realities as they tried to set about their daily lives in the weeks that followed this experience? There would have been constant reminders in their environments, on the news. Their limbic systems would still be experiencing flashbacks to the experiences. And then, of course, how the people in their worlds responded to them would play an important role in how they process those experiences. For those experiencing post-traumatic stress, daily interactions are vital for restoration of health, not just with family and professionals. In an environment in which dismissing emotions, shaming, or negativity are the norm, a person experiencing trauma will feel under attack or at risk, and the sympathetic nervous system will respond accordingly. We don't know how the people around these men responded to them. It wouldn't have been unusual for people to say nothing because they didn't know what to say, or to try to focus on the positive, or to avoid them totally. In this environment, it would be hard for these men to feel seen, to feel connected and safe. Perhaps colleagues, friends, and acquaintances, in not just the weeks, but the months ahead, did understand how trauma affects the body and brain and the importance of connection. Maybe they made eye contact, their facial muscles demonstrated openness, not judgment, and the intonation of their vocal muscles was calming. These daily interactions would have played a large role in the restoration of functioning by providing the environment where the sympathetic nervous system wasn't reactivated and where the feeling of acceptance and safety could support the process of making meaning from the experiences. In the Defence Force, leaders can use the knowledge of post-traumatic stress and the importance of connection with others to develop a trauma-informed environment. This would help to alleviate post-traumatic stress and play a role in preventing the development of PTSD. The acknowledgement of post-traumatic stress as a normal physical response to a situation means everyone has a responsibility to aid recovery, not just family and not just professionals. Thank you for listening. Goodbye.